If you've suffered a hamstring injury, we want to show you some simple exercises to try to get better. I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist, Yves Gigi, and we're going to talk about a really painful injury. And I know that personally because I've suffered this, and that's a hamstring injury. It can be sort of mid-thigh. You may injure it a little higher up, closer to your buttock. Usually things like sprinting or explosive movements, maybe lifting weights, but it can really set you back for a week or two. It can set you back for 3 or 4 weeks. In my case, I was out of weights for 9 weeks with my injury. We don't want that to be you. So we're going to talk about some things you can do at home to try to get over this. So I'll turn it over to Yves. He's going to take us through some things that you can try.
So you have that initial hamstring injury, like you said, and you're really going to try to take, let's say, anywhere from 2 to 3 days, maybe more if it's more severe, off completely, right? So if you just injured it, maybe give yourself a little bit of time to heal. But here's some exercises that you can do very early on to make sure that you can start the healing process super quick. So the first one, we're just going to do a quick hamstring stretch. It's a way to just get that muscle to feel a little bit better, get some motion back, and hopefully promote the healing process.
Okay.
So first thing, you can get a chair at home, or if you have a bench like this, that'd be great. So you're going to stand facing the bench.
Okay.
I want your feet facing the bench. Believe it or not, that's super important. And then we're going to bring one foot up.
Okay, so we'll say this is my right hamstring that's hurt.
Right,
Okay.
it's sprained, okay? So once we're in this position, the way we increase the stretch is by leaning forward, okay?
Toes up, or does it matter?
Yeah, I would say toes up.
Okay.
Yep. And if you lean forward, that's ideal. We want to make sure we're not rounding too much at the back. You're going to have to round a little bit, that's okay, but we definitely don't want to see this happening, right? So you'll lean as far forward as you can until you start to feel a good stretch in that hamstring.
Hopefully you're more flexible than I am.
Something we can work on. So very slow, very gently, anywhere from 30 seconds to a minute is going to be ideal. I would say 2 to 3 times.
Okay.
And I would do both sides. If you're there anyway, you might as well hit the other side.
Okay, that makes sense. Yeah, you can really feel that. And somebody that may have just done this a few days ago, just go to the point where it's stretching but not super painful, right?
Yeah,
Okay.
Absolutely. That's what we tell a lot of our patients, is you want to get there just when you're starting to feel some of that pain. You want to hang out right there until it loosens up. And then if it does, you can start to go a little bit.
Okay, great.
All right, so we got to stretch in, right? And now we've got to work that muscle a little bit, right? We got to start to get it stronger, start the healing process.
All right, let's do it.
All right, so the next one is we're going to do what's called a single leg deadlift. A lot of people know the deadlift. A lot of people haven't heard of the single leg deadlift, okay? So we're going to start is by standing on one leg, getting your balance, and then we're going to lean forward with our chest and let our leg come up behind us. You're going to lean as far forward as you can.
Balance is not a skill of mine.
Until you feel a little stretch in the hamstring. This is, again, a dynamic lengthening of that muscle, which has really been shown in a lot of studies to help the healing process and get people back on the field, back to doing things a little bit quicker, a little bit sooner. Perfect. So maybe we can show them facing the other way.
Okay.
Yep. So same thing. And actually the benches here is perfect. You can lean forward and use this as a little bit of a balance on the bottom. Yep, very slow. We're doing this for reps. You're really not holding the bottom at all. So I would say anywhere from 5 to 10 reps is going to be ideal on both sides.
Okay.
2 to 3 sets. As we've said before, pain is your guide. If you have a little bit of pain, decrease the range of motion, and I think that'll help a ton.
After you do these, I'm just curious, because you, even if you haven't hurt your hamstring, you can feel this. Should they ice maybe for a few minutes after they do these, because they're getting this all warmed up, or should they leave that warmed up blood flowing
Yeah,
going?
I like to leave the warmed up blood flow feeling, right? You can maybe do a little bit of soft tissue work, like a foam roll or a lacrosse ball, to help soothe those muscles, because sometimes that stretching feeling, right, is a little bit, almost makes things tighter, right? And
Yeah.
it's painful. So doing a little bit of foam rolling, soft tissue work can be a great way to seal the deal.
Well, if you have this problem, and I suspect that you do, just in my practice, I see tons of people that hurt their hamstrings that come in 3 weeks, 4 weeks, 6 weeks later. They probably should have done this from the beginning. So this is really good stuff, very helpful information. If you've suffered a hamstring injury, click the videos below for much more helpful information. You'll also find links to Eve's social media account so you can get tons of great stuff from him. Make sure to subscribe for all kinds of sports medicine content, and we look forward to seeing you right here next time.